MDs of their hospitals, the members of their state assembly, everybody in the health system. At least 3, 4, 5 states have come, to understudy what we are doing. Okay, over 70 hospitals in this country today have adopted the same electronic medical records that we pioneered. All right, so it's been a big transformation, with all due respect. Okay, even Lagos Business School wrote a case report on what we have done
for the past 7 years, because I've also been here for the past 7 years. The healthcare here is very, very fantastic. You even see from the environment, everything there is changed. Initially, they were using a card, but when you get there now, you have your own card, and they respond. They are very effective. The healthcare here is very good. It has improved, even from different places, even not only our local government. They bring people here because they know they are very good. So it has improved a lot of our people's healthcare. So they don't have any issue with the medical center.
Apart from the equipment not readily available, personnel too were so short. But for the past 5 years now, there has been a tremendous change, whereby the new state-of-the-art of equipment for an ICU setting is on ground. We have personnel.
If I give you the kind of figures that we started with and the kind of figures we have now, you would appreciate the enormous expansion that has taken place. When we took over, the hospital beds in the hospital was about 72 beds. We're a 72 bedded hospital. Okay. Today, we are 450 bedded hospital. Okay. When we took over, we had 3 theater suites in the entire hospital, 2 main theater and 1 serving the maternity. Okay. Today we have 12 theater suites, all fully equipped. Okay. I always tell this story. When I came to this hospital as medical director, there was only 1 single patient monitor that was not working. Today we have over 500 patient monitors. Indeed, in our hospital, every single patient has a patient monitor, and all the patient monitors are linked to a central monitoring system, which feeds into our electronic medical record. Okay, as at that time too, we had no mortuary, so we had to take corpse, okay, from our hospital to outside mortuary. Today we have a functional mortuary. At that time, we didn't have a standard CSSD, Central Sterilization Unit. And you must know that the Central Sterilization Unit is key, is actually the glue, okay, that controls and ensures the quality of, materials that you are using in the hospital, either for surgery or wound dressing or injection or whatever. Okay, we didn't have a standard one at that time. But we have today created a standard CSSD that has remained the reference point in the country. Okay, when people want to set up CSSDs now, they come here. On an annual basis, we'll probably train about 5 or 6 or 7 hospitals who send in their staff, some of them maybe up to 10 workers, okay, to train in our CSSD, okay. And Jetinj has named our CSSD as their training center in the whole of West Africa.
Well, I would say small body, big engine. Obviously, space is a challenge here, but within that limited space, I can see a lot of creativity to make sure that those small places are optimally utilized. And I can see that there's a lot of digital penetration in the operation of the the paperless system was demonstrated to me, and I saw it work. And I could also see that the kind of supportive equipments that are available is of good quality. And I think that in the agenda of Mr. President to reverse the direction of medical tourism, FMCEB Compendium is positioned to play a very, very big part within that agenda. So I must commend the management and staff of the hospital for the work they are doing.
I was privileged to have served in the Federal Ministry of Health as the Minister of State for Health, under whose supervision were the federal medical centers throughout the country. And I can tell you that Federal Medical Center in Butemeta, under the headship of Dr. Damola Dada, is a flagship center, in terms of healthcare delivery for Lagos and its environs. And like we always say that everything in a system is a function of the leadership in that system. And of course, the leader of the team, the healthcare team in that place, is Dr. Dada. And I was quite impressed, and I'm still impressed about the transformation that he has brought to bear in that place, across all the areas of healthcare delivery in that hospital, the Federal Medical Center in Butemeta.
Actually, it should be a case study for other institutions to study. And I would recommend that even facilities offering leadership programs and executive programs in business schools should understudy and use Dr. Dada as a case study. I pray that one day Dr. Dada will have the opportunity of serving Nigeria at a higher level, beyond FMCEB Butemeta. That's my prayer. When he can replicate what he has done at Butemeta on a national scale.